Hello, this is an overview of a public health practicum in partial fulfillment for a master's degree in the science of dental hygiene at MCPHS University by Jennifer Hochschild. The practicum site was at the Holyoke Health Center in Holyoke, Massachusetts. This is a federally funded or federally qualified health center to serve patients in the community and specifically for individuals that are on the state insurance, Mass Health. The programs to be developed, the Holyoke Health Center wanted to develop a sensory-friendly dental clinic for children with the autism spectrum. And that's a nice picture of the new pediatric dental clinic at the Holyoke Health Center. The steps, an overview of the steps to establish the sensory-friendly dental clinic included establishing the needs of the children with ASD, establishing the needs of the dental providers working with the children with ASD, researching the characteristics with evidence-based literature, professionals and individuals with specialties in characteristics and needs of the children with ASD. Research other programs and treatment used by other facilities, offices, and organizations regarding sensory issues, and develop a step-by-step program to assist in all of these needs. The first step that we established that we needed, that the health center needed, was to create a Know Your Patient questionnaire. And this would to establish a better knowledge of individual children's needs. And this questionnaire included the medical history, behaviors, and emotions geared to specific anxieties or fears they had, communication development, whether the child was verbal or nonverbal or somewhere in between. Sensory issues, specific sensories, kind of geared towards oral, like their oral fixations, their gagging, grinding, biting, um, or other ones that they might have that the parent would inform us about. Also, we wanted to know about dental visits. Have they been to a dentist? Do they seek regular visits? Or have they not been at all? Is this their first attempt? Also included is the diet. What type of food they eat? Is it sugary, sticky? Is it certain kind of things they like? Do they eat regularly? And also their oral habits, which isn't listed here, but I believe the oral habits were put on the questionnaire as well. And this will be, the questionnaire will be on the live text and shared with the discussion board as well for an overview. So the second step was to organize a meeting to share information about the characteristics of the children with autism. A lot of research went in um, to find what these children's characteristics were and the sensory issues they had. And we found some main things that we wanted to discuss at the meetings that was specific mostly to dental visits, and that was to discuss the language the children used, to be able to understand them and to communicate with them, um, and to develop a poster about the language of autism for training and educational purposes for the dental providers and colleagues. And this poster was a really fun, neat thing to do. A little stressful putting it together, but we were able to put it together. And we also were able to share and display at the American Academy of Developmental Medicine and Dentistry conference this year in Chicago on July 8th and 9th. And it was a great piece to share, and everybody was really interested. So here is a picture of the poster, the final product, and this will be shared with the organization Autism Speaks as a resource, and also I believe the ARC of Massachusetts still needs to contact them. So this resource might be seen in other places. It's going to be hanging up in the Holyoke Health Center's clinic and hopefully others. And these little cartoons show different, we geared it towards a dental office, and it showed different languages that the child has and how they understand and what they understand as language. So that will be uploaded as well for individuals to see and can learn from it. So, and the third step was to establish a social story and a dental kit for the parents and the children to use prior to the oral health care appointment and at the appointment as well. Um, a child that uses a social story, which is a step-by-step guide for a task. Social stories can be used for many things: brushing your teeth, getting dressed, eating dinner, picking up the plates from dinner. It's really a very simplistic step-by-step guide for these children that kind of need to see the first step, turn the page, see the second step, know that they have accomplished the first step, and now we're doing the second step. And they need to have like a beginning and an end. So this social story is a huge part of our program. It's specific to the Holyoke Health Center. So we produced the social story geared to the Holyoke Health Center Pediatric Dental Clinic. Um, and we took photos. I took photos of the dental clinic and kind of went a step-by-step guide through the dental appointment and tried to establish a fun and easily relatable story for the children with ASD to relate to and use prior and at the appointment. This social story will be shared as well on the live text and through the discussion board, I hope. It is a model that we want to kind of establish for other dental offices and organizations to use. So And in the dental kit, there will be a disposable mouth mirror, a small key ring, flashlight, a toothbrush, and the social story. So this kit will go home with the parents when they come in for that initial visit with the dentist, after they've gone over the questionnaire and spoke with the dentist and maybe visited with the child and talked about this kit. This kit will go home. A letter will go home with the kit, talking to the parents about how to use it, maybe sitting with the child once a night or a couple times a week. Sometimes once a night's a little much, but as much as possible, using the mouth mirror to show the kids how it feels in their mouth and what the dental provider would be doing. The flashlight using in the mouth specifically, just to show them that there might be a light that needs to be used to see all the areas inside their mouth. The toothbrush can be used brushing. Hopefully they're already brushing their teeth, but it's kind of a nice little give to them, and including the social story so they can kind of read along the story, go over as many times as they want, go back to certain steps if the parent can go over it with them, and kind of use a disposable mouth mirror maybe with the story and the flashlight and the steps. repeated use will help to guide to a successful appointment. This is a large um, uh, picture of the actual social story. It's called Going to the Dentist, the Holyoke Health Center. We just kind of took the logo. This is the doctor that I worked with, Dr. Priya, and myself. And a link for the social story will also be available to for everybody to view. So, these three steps were the goals of the first part of the program. We're hoping to go on to a second part of the program. The second part and the ongoing efforts of the program will continue with more research about the sensory issues and products to use with these children. Um, just quick research has shown, some things like the RDH portable polisher. Maybe some of you have used it. It's kind of quiet and it's portable, so you can move around the clinic if they're not comfortable sitting back in the dental chair, maybe a chair in the corner of the room. Creating a sensory-friendly dental operatory may include low lighting, low sound for equipment, calming atmosphere, limited persons in the room, so there's less distractions for the child when there's probably not like music. Some most offices have like a music in the background, other sounds in the background. Of course, the door will be closed if the parents and the child's comfortable with that, just to eliminate any extra sounds that can kind of throw these kids off when there's so many sensory stimuli in the dental clinic. Keeping with the same providers, working with the children with autism is very important, that they know routine and this is the person that will be working with me, or these are the people that are my team working with me. And also, I think the parents are comfortable with that as well. And possibly a waiting area geared specifically for their needs. This was just an idea that was thrown out at one of our meetings, which I thought was pretty interesting. Someplace where the parents feel comfortable. Sometimes the children with autism might be unsettled. They might want to walk around, flap their arms or something. So a comfortable place for them and for the parents not to feel judged is important. Um, that the future. So, and also searching for grants to fund sensory-friendly operatory will definitely be in the next few steps. So this is a continual program, and hopes that we can share more with everybody in the near future. It was a great program to be working on, and I was asked to stay on the team, so uh, I am very excited. So thank you for listening, and good luck to everyone, and see you soon.